916,000 jobs were added to the U.S. economy last month, but women only gained 1 in 3 of those. Experts say most of the job gains for women have been a reflection of schools reopening. But women are still down by more than 4 million jobs since the pandemic began. Working women were hit harder by the pandemic than working men due to child care demands and the disproportionate impact the pandemic had on female-dominated industries. Ivy Prep Learning Center founder Dr. Rebecca Mannis joins me now to discuss the impact the pandemic has had on working mothers' mental health. She's a developmental psychologist, learning specialist, and neuroscientist. Rebecca, welcome. Thanks very much for being with us. Why have more mothers than fathers been leaving their jobs to address child care demands during the pandemic?
I think there are a couple of reasons. One of them is that they bear the brunt of managing, doing their jobs well, and raising the children. And that's a pattern in general that's only been, what I say is, on steroids by virtue of COVID demands. As we've needed to do the proverbial pivot, it then comes back to become the mom's responsibility to manage. And of course, that impacts everybody.
Well, how have these demands on mothers impacted their mental health?
It impacts the moms in practical ways. For example, in terms of feeling the brunt of less income when their expenses build up, and it is impacting the family. Also, moms develop a sense of themselves by virtue of the multiple hats that they wear. And so when they need to stop work or feel that they're not working effectively, that impacts them as well. Finally, their sleep cycles are thrown for a loop. It impacts their relationships with their spouses. And we're in that sandwich generation where we're also thinking about our parents' needs. So it impacts them both psychically and also practically.
So how are these stressors on moms impacting their children?
Well, we know that children are hardwired from the time of their birth to respond to their parents' facial expressions and their emotions. In fact, we know that mirror neuron systems in the children's brains actually fire in response to a parent. So that is difficult because not only are the moms and dads feeling the stress, but the children are aware of it and they're trying to make sense of it. I think because it's such an uncertain time, another reality is that the parents sometimes are trying to shield the children, but because we're so on top of one another and because children can read their parents so well, it really just doesn't work.
Yeah, it seems like such a domino effect. So, Rebecca, what structural and systemic changes do you think need to be made to relieve some of the burden on women and mothers in particular?
I think there are immediate and longer-term ones. And I have to say, as the child of the person who founded the first nonprofit daycare center and infant program in New York, it's a topic close to my heart. I think one issue is that we need to look at what moms need right now. We need to really understand what they feel will make a difference and provide flexibility so that it doesn't need to be so binary. Perhaps it doesn't need to be working or not, but rather, what do you need right now? How often should we try to step back and reassess? And then again, this is an opportunity for us to think about how to set up opportunities for families at home and at the workplace so that we can support the parents and perhaps also think about other ways to help the children and alleviate some of the burdens that exist there.
All right, Rebecca Mannis for us. Rebecca, thank you very much for sharing your insight with us.
Thank you.